Coming, knock knock, come into the room, clean my hands. Hi McKenna, my name is Freddie. I'll be your nurse practitioner today. So what we'll be doing is head, ear, eye, nose, throat, lung, and cardiac assessment. Okay, so let's start with your head. I'm gonna start feeling it, checking for lumps, any depressions. Scalp appears to be clean. Okay. Checking for any lesions. Lips don't appear to be cracked. No lesions either. Skin tone seems to be normal. General appearance seems to be well groomed. Good eye contact. Okay, let's see, where else do we go? All right, checking for some symmetry. Everything seems to be, I don't see any eye drooping in the eyelids. Okay, eyebrows seem to be okay. Eyelashes seem to be okay. All right. So I'm gonna add, so what we're going to be testing is, we're going to be testing cranial nerve 5, and we'll also be testing cranial nerve 7. Cranial nerve 5 is facial, and cranial nerve 7 is trigeminal. Okay, so a few things we're going to do. We're going to ask you to close your eyes. Sorry, going to take off your glasses for one moment. Close your eyes really, really tight. And I'm going to try to keep them tight. I'm going to check them against resistance. Don't let me pull them up. Don't let me pull them up. Very good. Those are normal. I'm going to go straight there. Okay. And raise your eyebrows. I do see good symmetry. It's very good. Very good. Let's see. What else am I missing? Just checking the rubric really quickly. And let's do facial sensation. I'm going to have you close your eyes. And so we're going to test this on your hands first so you can know. We're going to test dullness and sharpness. All right? This is what dull feels like. This is what sharp feels like. Close your eyes for me. You're going to tell me what you're feeling.
Sure.
Okay, now when I start doing the testing, I want you to tell me what you're feeling, dull or sharp, and I also want you to describe what area I'm touching, okay?
Dull on my right cheek.
Can you say that a little louder for me?
Dull on my right cheek.
Good.
Dull on my left cheek. Sharp on my chin. Sharp on the right side of my forehead. Sharp on my left cheek. Dull on my right cheek. Sharp on my right cheek.
Very good, very good. I'm also going to check the occipital lymph nodes. Checking to see if there's any swelling. I don't notice any swelling. Are you feeling any tenderness?
No.
Alright, and we're going to check here. We're going to be palpating the temporal muscles. Any tenderness?
No.
Okay. Going to check the masseter muscles. Any tenderness?
No.
Okay, so right here, going to check your jaw. Not feeling any crepitus, which is normal. That's good. Okay, I'm going to ask you to open your jaw. Okay, not hearing any clicking, doesn't feel displaced at all. Then I'm going to ask you to extend your lower jaw up and out. Okay, that's normal. Don't notice any issues there. Okay, and then I'm going to check your submandibular lymph nodes. Okay, Not noticing any swelling. Are you having any tenderness?
No.
Okay. Then check the subsegmental lymph nodes. Any tenderness?
No.
Not noticing any swelling. Okay, very good, very good. Okay, let's see. What else are we missing? We'll go with your eyes. Just double check, make sure we're not. We're going to start checking your eyes. And what we're going to be doing something is called the Hirschberg test. So what we're going to do, I'm going to have this light right up by the bridge of my nose, have you look straight forward. I'm going to be seeing if there's any corneal deviation. Look straight ahead. Look straight, like far into the distance. Straight into the distance. Right behind me. Now we're going to cover one eye. I'm going to cover one eye for you. Keep both eyes open. I'll cover one eye. And then when I uncover this eye, I'm going to be checking to see if there's any deviation. Looks good. Okay, keep both eyes open. Looks good. Alright. Let's see. And I'll check for direct light. Looking to see if the pupil is reacting. Yes, it does. It's reacting to the light. Okay. And then I am going to look at the opposite eye as I flash the light to check for consensual. That's good as well. Then we're going to do direct light to this eye again. Reacting appropriately. Going to do consensual. Eyes open. The opposite eye is reacting correctly. That's very good. Very good. What else are we missing? Sclerae appear to be clear. The lacrimal ducts, don't see any discharge or any excessive tearing. The conjunctiva look moist. They don't appear to be pale, which is good. They appear to be pink. Sorry if that's a little awkward. What else are we missing? And then we will do some extraocular motor testing, which will be it'll be your cranial nerve 3, cranial 4, and 6. So that would be, where's my brain? I'm trying to blink. So 4s are trochlears, 6s are abducens, and 3, I want to say ophthalmic. Alright, so I'm going to have you look right up front. I'm going to go up, follow just your eyes. Then down, very good. And then go center, then we're going to go to your right, to your left. That's this corner. Just your eyes. check your peripherals. So I'm basically going to go behind you and you're going to tell me when you start to see.
No.
Okay, good. And we're going to put this one.
No. No.
Okay. Now we're going to close one eye. Try the same thing. Keep it one. I'll have you close that eye. Sorry.
No.
Keep the eye closed. Still gonna keep testing. I'm sorry.
No.
Okay. Now we check this eye.
No.
Very good.
No.
Very good. Alright. Doing very good. So, let's see. We're going to have you go 20 feet away from this sign. I'll let you do check with your glasses. Okay. And I'll have you stand over there. We're going to first do it with both eyes. Then you tell me what's the lowest line you can see.
Seven.
7? Okay. That's good, that's good, that's good. Okay, so can you read it?
FELOPZ.
Okay, very good, very good. Now, okay, now let's check your left eye. So I'll have you close your right eye. Cover your right eye, right? And you tell me what's the lowest line you can read.
Still 7.
Make sure you.
FELOFD.
Okay. Now let's close the left and see the right. Okay. What's the lowest line you can see? Using just the right eye, please.
6.
6 is the lowest you can see?
Yeah.
Okay.
EDFCZ.
Okay. Very good. So we would say in your right eye you are 20/30. And in your left eye you're 20/25. So basically that means what you're seeing at 20, you should be able to see at 30 in your right eye. And what you're seeing at 20, you should be able to see at 25 feet in your left eye. Okay? I need to get some glasses adjusted. That's okay. That's okay. That's okay. That's why we do these assessments. And I'm going to be doing a fundoscopic assessment. So I'm going to be turning on my fundoscope. I'm going to be checking for the red reflex. Thank you. So I'm going to go for your right eye. I'm going to go to the right until I see the red reflex. nerve seems to be intact. No signs of any macular degeneration. I'm going to go left to left. Look for the sign. I forgot to look for the red reflex. So get to 0. Reflex. The nerve seems to be intact. No macular degeneration noted. Very good. Then we'll be checking your ears. First, I'm going to inspect and see the lesions. Doesn't appear to be red. It's be intact. They seem to be abnormal. Intact. Don't see any redness in the canal. It's good. Okay. They appear to be symmetrical. Okay. Gonna touch your pinnas. Don't notice any bumps. Are you feeling any tenderness? We'll be touching tragus. They feel okay to me. Any tenderness?
No.
Good, good. Okay, so we're going to go in with the otoscope. And we're going to be lifting your pinna upwards just to get a clear look into the canal. Appear to be pearly and gray, no signs of inflammation. It's very good. There's the 7 in there. Okay. Pull it upwards so I can get to the ear canal. They appear pearly gray. I do see the backward 7. Very good. What I'll be doing is testing the sound with this tuning fork. This is what we call a Weber test. Alright? So you're going to let me know if you're hearing it bilaterally, both ears, or if you're only hearing the sound in one. Then we're going to be checking for bone conduction and air conduction. You tell me when you stop hearing the sound. Okay. From here?
Stop.
Here? Very good. Then That was the Renee test that we just did. We're going to do a whisper test. So we're going to use a 2-syllable word in one ear. You're going to cover this ear. We're going to whisper a 2-syllable word, and you know what it is.
99.
You can say it louder for me?
99.
Okay, thank you. Very good. Thank you. Now let's see. Okay, so we're going to go oral. We're going to check your mouth. We're going to clean our hands. Open the tongue depressor. And have you open up your mouth. Stick your tongue out, please. I'm also going to bring in the light. Take this off. Well, actually, before we go to your mouth, we're going to go to your nose. We did skip that. That's very important. Checking to see if you're feeling for any bumps. Okay. Earlier, we did forget to check the sinuses. So I'm going to check your frontal sinuses. Any pain when you feel here?
No.
Doesn't appear to be swollen, not red. We're going to check your maxillary sinuses. Swelling, pain here. Good. One thing I'm going to do, I'm going to block off one nostril. Ask you to breathe in and breathe out. How does that feel? You ready to breathe? Okay. What about on this side? What would you say about the same?
Yeah.
Good. Glad to hear that. Okay, I'm going to have you look upwards. Okay, looking at the septum, don't see any deviations. No deviation in the septum. Okay, I'm going to go into the left nostril. It's going to be slightly uncomfortable. Checking for the turbinates. They don't appear to be swollen. Nice and pink. Very good. Okay. We'll check for the turbinates on this side. It'll be nice and pink. Good. And also moist. That's very good. Good. Alright. I'm going to have you do a blind smell test. So I'm showing the camera what we have here. Okay, so please close your eyes. And I'm going to ask you to block your right nostril. Keep your eyes closed. Block your, yes, thank you. Eyes closed, please. And sniff, inhale. And what would you say that smell is?
Ginger.
So you open your eyes, but the good thing is the sign is not on the side. I trust your judgment. I trust that. That's okay. Sorry, just closed out my rubric accidentally. Okay, and we're going to keep your eyes closed, block out the left nostril. Take a good whiff. Garlic, very good. Correct, that was garlic. We'll put that to the side. I'm going to assume that my hands are already cleaned, and we are going to go into your mouth. I'm going to have you Start your gun for a moment so I can do a good assessment. Thank you. Sorry. It's a really big piece of gum. Wow. Okay. Smile for me. Just let me take a quick look at the tip in the front. Look good. And then open up wide. Stick tongue out. And no, stick your tongue out. And open wide. Okay. Soft palate seems to be okay. Hard palate seems to be intact. Some pink, moist, don't seem to be inflamed. Uvula is midline. Okay, gag reflex is intact. We're checking vagus and glossopharyngeal, which is cranial nerve 9 and 10. All right, and then let me open up your mouth some more. Looking in the inside of the buccal mucosa, looks pink, moist. Don't happen to see any sores. Lift the tongue up for me. Checking the frenulum, looks okay. The glands look okay. It's very good. And I am going to put some gloves on and palpate inside of your mouth. And I'll also use some more light. Just take a assessment of your teeth. Assess the dentation. Open up wide. See some fillings, don't happen to see any. That's okay. Teeth look intact. Checking the buccal mucosa, don't notice any induration, any sores. Okay, very good. Gingiva looks okay. Upper and lower, very good. Then just want to check the roof of your mouth. Very good. Don't notice any sores, no any abnormalities. See some fillings right here on that side. That's okay. All right. Dentation looks good. And we will check hypoglossal. That's cranial nerve 12. We'll have you stick your tongue out and then tip and move it upwards, downwards, left, right, all around town. Very good. Okay. And something we forgot to check was the cheek test. Another facial cranial nerves 5-7. Blow your cheeks out for me and don't let me push them in. Okay, good strength bilaterally. Good, thank you. So we check your mouth. That's very good. Alright, so I'm going to check your neck. I think I did check your occipital lymph nodes. Still checking, no swelling. Good. Any tenderness?
No.
Okay. And we're going to check the retro or auricular lymph nodes. Any pain? Okay. And the preauricular lymph nodes. Any pain? Okay. I'm not noticing any swelling, any redness. That's good. Very good. And we're going to check the, I believe I checked the submandibular lymph nodes already, but we'll just double check that just for good measure. No pain, no tenderness, okay, doesn't seem to be red or swollen, or that's very good. Segmental, we check. Any pain? No. No, appear to be red, swollen. That's very good. Let's check your carotids one at a time. auscultate your carotid diaphragm. Good. Check with the bell. +2. Correct. Check with the diaphragm. +2. Not noticing any bruise. Not detecting any bruise, no. Very good. +2 bilaterally, no bruise. Check for lymph nodes over on this side by the sternocleidomastoid. Any pain? Not noticing any swelling. It's very good. We'll check the subclavicular lymph nodes. Any pain? Not noticing any swelling. That's good. Scapula, lymph nodes, any pain? Check your trachea. Just make sure, checking to see if it's moving. Okay, and it does appear to be symmetrical. I'm going to manipulate it to the left, right. Okay, and now I'm going to go from behind you, and I am going to assess your thyroid. Not noticing any goiters there, that's good. Not noticing any swelling. Okay. So we are on your trachea, looking for the cricoid. Can you swallow for me? Can you swallow one more time for me? Swallow again? Sorry. Just not able to feel it. Okay. Okay, that's the tricoid, that's the cricoid. So now I'm gonna go beneath the tricoid. That's where the isthmus of the thyroid is. So then I'll go laterally and try and feel. Okay, any tenderness?
No.
Not noticing any swelling. Okay. Have you been having any feelings of extreme hotness, extreme coldness, jitteriness, anything of that nature?
No.
Night sweats, nervousness?
No.
Okay, going to be checking your lung sounds. Oh, wait, before we check that, let's check your cranial nerve 11. That's the accessory muscles. So I'm going to ask you to shrug your shoulders. Okay, seem to be moving bilaterally. And don't let me push down. Very good. Okay. And see, can you move your neck to resistance? Can you move? Okay. Turn all the way to the side. Turn all the way to this side. And can you move against resistance? Very good. Very good. Any soreness in your neck? There doesn't seem to be any nuchal rigidity. That's very good. Then we'll go on to the respiratory side of things. Just going to take a quick inspection. We're not going to pull off patient's shirt completely. Just going to check to see. Okay. We'll put on some gloves just for sync. seeing any rashes, any skin issues. Skin seems to be okay on the chest. Okay. And then, left shirt here. Skin seems to be okay. Feel. Not feeling no palpable masses. It's good. Any soreness?
No.
Some bronchial sounds. Deep breath. Sorry. Okay, bronchial sounds. No adventitious lung sounds noted. Bronchiovesicular. Bronchiovesicular, no adventitious lung sounds, no cracked holes, no wheezing in that nature. I'm not hearing any rubs, gallops. No, I'm not rubs and gallops. No wheezing, no crackle, no stridor. Deep breath in and out. Bronchiovesicular. Breathe in and out. And we'll check. In and out. I'll ask you to cup your breast upwards. Thank you. Deep breath in and out. Vesicular. Clear, non-adventitious. Vesicular. Vesicular. Very good. Okay, so I'm gonna go toward your rib cage. I'm gonna be checking for thoracic expansion. When you're breathing in and out, I'm checking to see if it's equal bilaterally, equally. Okay. I'm gonna push right here. Okay, I'm gonna actually take a deep breath. Appears to be equal. That's very good. Thank you. I'm going to check for stereo sounds. I'm going to check your back, skin on your back. I don't appear to see any sores. Not feeling any lumps, bumps. Take a quick listen to the lung sounds. Start from right. Deep breath. Breath. Deep breath. Deep breath. No, actually, let's turn over. Let's turn to the side so I can see what I'm doing. So I'm making sure I don't go into any dull areas where the scapulars are or where the spine is, because then it will be dull. So I'm going more so in the middle here. And then once I get down, I'll fan out. Deep breath. I'm also going to be checking for expansion. We'll be looking in the back. So on the cup, I'm going to try and make a squeeze a little bit. Then breathe in, breathe out. Breathe in, breathe out. Okay, expansion is equal bilaterally. Okay, going to do a little percussion. Checking for dullness, checking for resonance. Should be hearing resonance, should be air in the lungs. If it's dull, it would indicate that maybe there was an issue going on. If there was an abnormal finding. Resonance. Okay, we're also going to be checking for diaphragmatic excursion. So that's basically to make sure that your diaphragm is expanding, your lungs are expanding correctly. Well, equally bilaterally. So I'm going to go by the mid scapula. And start counting down from there. So we're trying to figure out where the diaphragm is, and we'll note where the diaphragm is. Sorry, just pause for 1 second. So,